Welcome to your screencast on the brachial plexus. This is a real general cover of the brachial plexus, and the majority of the slides and images that you will see come from University of Michigan's Blue Link. I like this image because it really depicts the brachial plexus coming from the ventral rami of C5, C6, C7, C8, and T1, and how it forms three different trunks. You are not responsible for the trunks of the brachial plexus in the lab, but you should have an understanding that these plexi are interwebbings of nerves. So moving beyond the trunks, we would have those anterior and posterior divisions, and finally reach the three cords that you are responsible for knowing in the cadaver lab. First, we have your medial cord, which if we follow back would go to your ventral rami C8 and T1. In the middle here, we have your posterior cord, and if we follow that back, we know it comes from the ventral rami C5 to T1. And lastly, your lateral cord comes from the ventral rami of C5 to C7. So now let's look to see how these cords branch into the terminal nerves that you're responsible for. First, we have your radial nerve. And if we follow the posterior cord here that you see in the purple, extending out from there will be your radial nerve. This radial nerve will travel posteriorly. So the other area in which you can see the radial nerve well is here in the area of the triceps brachii muscle. So this is a posterior view of the arm, and you would find the radial nerve between the lateral head and the medial head of the triceps brachii muscle. The radial nerve will then extend into the forearm and branch into a superficial branch that will give more cutaneous supply, and a deep branch that will continue to supply posterior forearm muscles. Next, we have your axillary nerve, and this too comes off of the posterior cord seen in purple here. So in the light pink, we see your axillary nerve. The axillary nerve is responsible for supplying two muscles. One, in this posterior view that we can see, is your deltoid muscle, and the other is your teres minor, which we see here outlined by my arrow. Here's another view where the deltoid has been pulled away. This is a posterior view, and you could see the axillary nerve branching out to give supply. Next, we have your median nerve, and the median nerve is very unique in that it comes from both the medial cord and the lateral cord. We have two branches extending off of those cords. These would be the lateral root of the median nerve and the medial root of the median nerve. When those roots come together, they create in pink this median nerve. The median nerve does not do anything within the arm portion, but as it heads down into the forearm, it courses deep to your flexor digitorum superficialis muscle, courses deep to your carpal tunnel, and extends into the hand to give supply to some of our hand muscles and also cutaneous supply. Next, we'll discuss the ulnar nerve. Here you could see your medial cord, and branching off of the medial cord in pink is your ulnar nerve. Just like the median nerve, the ulnar nerve does not supply anything within the arm, but once it heads into the forearm deep to the flexor carpi ulnaris muscle, it extends down outside of the carpal tunnel to give supply to most of the hand muscles. It also gives supply to some forearm muscles in the anterior compartment, and this nerve is special. If you remember from Anatomy and Physiology 1, this nerve courses posterior to your medial epicondyle of the humerus in the region that we call the groove for the ulnar nerve. And our last terminal branch of the brachial plexus is your musculocutaneous nerve. You can see the lateral cord here, and in pink is the musculocutaneous nerve. Here it is extending laterally to 88% of the time, pierce the coracobrachialis muscle. Here's another view of that musculocutaneous nerve extending over to the coracobrachialis muscle. Here, the musculocutaneous nerve supplies all of the anterior arm muscles, and then as it extends into the forearm region, it actually changes its name to that lateral antebrachial cutaneous nerve in order to give supply to the lateral forearm. And here's a view of that, what I like to call LAC branch, lateral antebrachial cutaneous nerve. No, you do not have to know this terminal branch name of the musculocutaneous nerve.